As a dermatologist, it is my goal to help you achieve your best skin or hair or nails. So here are a few things that dermatologists want everyone to know. Hey, if you're new here, I'm Dr. Sam Ellis and I'm a board-certified dermatologist. I'm here to help you understand your skin and find products that work for you. If that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. Now, I know I can't actually speak for every board-certified dermatologist worldwide, but in talking with my dermatology colleagues, there are certain themes around skin and skincare and dermatology visits that tend to come up over and over and over again, and that's what I really want to address in this video. This first one is really important, and that is if you are a patient in a dermatologist's office, we are not judging your body. What I mean by that is we don't care if you shaved your legs or if your hair is greasy or you have a little bit of body odor or you gained weight since your last appointment. We are not there to judge you. We are there to medically evaluate your skin and make sure that your skin is healthy. I know it's easier said than done to not feel a little bit awkward. Oftentimes you're meeting your dermatologist for the first time and they're asking you to be completely naked and vulnerable in front of them, but we need to check your skin. You can get skin disease in every nook and cranny of your body, and that's why we want to explore all of those areas. Now, of course, if you aren't comfortable with your dermatologist looking at a certain part of your body, you can let them know. But I also encourage you to let your dermatologist look at your skin. We are here to help. The second thing that I think every dermatologist would want you to know is that long-term or chronic skin conditions require long-term or chronic care. In dermatology, many times there are treatments for long-term skin conditions, but there aren't cures. So if I think of something like psoriasis or atopic dermatitis or eczema or female pattern hair loss or rosacea, these are things that patients often deal with for the majority of their life once they are diagnosed. And when we put someone on treatment for those conditions, we expect them to stay on treatment in order to maintain their results. The same goes for other long-term health conditions like diabetes or high blood pressure or hypothyroidism. When you're on the right medication, those disease states are very well controlled and you can live a happy, healthy life. But if you were to go off your medication, your high blood pressure might come back, your diabetes won't be well controlled, your hypothyroidism may be out of control. And for whatever reason, people can accept that with non-skin disease, but when it comes to skin issues, they expect a cure. And I'm not saying this to be negative, but a lot of skin diseases at this point don't have a cure, but we have good treatments. So just know that just because a treatment isn't going to give you long-lasting results once you stop the treatment, that doesn't mean that it's not working. It's working, you just have to stay on your treatment. Okay, I think the next thing every dermatologist would agree with, and that is we do not want you to remove growths or spots from your body unless they have been evaluated by a dermatologist and we have instructed you how to remove them or that it's okay to remove them. We don't want you tying or cutting off your skin tags. We don't want you trying to burn off your own moles. And the reason for that is there are things that can look like a skin tag or a mole, but are actually a skin cancer or something more problematic that need further evaluation or further diagnosis. And I always just get nervous that someone's going to take something off their skin or try to remove something from their skin, and then we won't be able to properly evaluate it. And that can be dangerous. I'll never forget a patient that I had in my residency, so during my training, who had come in with this growth on his foot that he had been treating as a wart for over a year, and it wasn't going away. So he finally came in, and it was a melanoma. And at that point, that melanoma wasn't just on his foot anymore, it had metastasized to his brain. So I don't say that to be alarmist, but more so to help you recognize that if there's something new or changing or growing on your skin, get it evaluated. And maybe even more importantly, don't try to take it off yourself. Now, of course, if you've gone into your dermatologist or your primary care doctor and they've told you, yes, this is a wart, you can treat it at home using A, B, or C methods, go for it. But until you have that diagnosis and are sure about what you're treating, don't do it. The next thing dermatologists want you to know is that cuts and scrapes do not need to air out. It is such a common misconception that if you scrape your elbow or if you have surgery, you want to leave it open to the air so it can air out or dry out. Don't do that. Keep it covered, keep it moist. That is what's going to help it heal and heal with the prettiest scar. And I know I've said this before, but the skin does not have lungs. It doesn't need to breathe. It doesn't need to be left open to the air when it's healing. And in fact, if you do leave it open to the air, what can happen is you form a scab, which you think might be healing, but really what that's doing is it's sending a premature healing signal to your body that's essentially saying, okay, I have a scab here. I'm healed. I don't need to make new, healthy, fresh skin to this area anymore. And what happens is you end up with delayed healing or slowed healing of your wound. So if you want your wound to heal as fast and as best as possible, keep it covered. Now, of course, course, if you have surgery or some other type of procedure, I want you to follow the instructions of the person who did the procedure. But I'm talking about like little cuts and scrapes at home. They're going to heal much better if you keep them covered and moist. Speaking of moist, don't we just love that word? Brings me to my next point of what every dermatologist wants you to know. And that is, if you're trying to keep a wound moist to help it heal better, we want you to use Vaseline and not to use Neosporin. If you have Neosporin in your medicine cabinet or in your first aid kit, just throw it away. Replace it with plain old petrolatum. And the reason for that is about 10% of people have a neomycin allergy, and that's an antibiotic used in Neosporin. And what happens is if you use Neosporin on a cut or a scrape and you happen to have an allergy to it, or later on in life you develop an allergy to it, which can also happen, it's going to prevent your cut from healing, and it can also make that area look so much worse. I'll show a picture of what Neosporin allergies look like. And you might be thinking, Dr. Ellis, we want to use an antibiotic ointment because we don't want an infection. But dermatologists have actually looked at that. And when you compare using an antibiotic ointment post-procedurally versus using a petrolatum-based ointment like Aquaphor, there's no increased risk of infection when you're using something like Aquaphor. And more importantly, there's this big potential downside of using the antibiotic ointment, which is having an allergic reaction or an irritant reaction. So stick with the petrolatum. The next thing I think every derm would want you to know is that if you're in our office and we look at something and you think we look at it for 2 seconds and can tell you the diagnosis and you're like, oh, that's ridiculous. Like, I can't believe they can just look at it in 2 seconds and know what it is. We can. And that's because we train for years and years and years and years. And we look at thousands of bodies. We look at hundreds of people on the weekly. And that's how we can make those diagnoses very quickly. But I feel like sometimes people feel very unsatisfied with their visit because they feel like a dermatologist didn't spend a lot of time with them to make the diagnosis. But the reality is, when you're really well trained and you see something over and over and over again, you can look at something very quickly and know exactly what it is. So just know that even if your dermatologist didn't spend a lot of time with you to make the diagnosis, they can feel confident in what they've diagnosed because of all of their training and background. Now, of course, there are exceptions to this, and I'm not saying your dermatologist should be in and out of the room. We've all had that experience with a doctor and felt very unsatisfied. If they need to educate you about your skin disease or teach you how to take care of your skin, they should be willing to sit down and educate you. That is a huge part of our job. But every derm has been shamed by an online review that says, my dermatologist spent 1 second looking at a spot and then ran out of the room after telling me it was benign. That's not the impression we want you to have of us. We just want you to know that there are certain things that we can look at very quickly and know immediately what they are. And sometimes patients will complain like, I'm not paying for that visit. They spent 1 minute with me. But what derms will say, or other doctors will say who can make quick diagnoses, is you're not paying for the time with the doctor. You're paying for the years of training that allow them to make that diagnosis quickly. And I would much rather my doctor make an accurate diagnosis than spend a lot of time with me and not know what's going on. Now, in my clinic, I think I can make pretty quick diagnoses, but I also like to spend time with my patients. I think that's a huge part of being a dermatologist, is you get this prolonged continuity of care with your patients. I see my patients for years and years and years. I meet their kids, I meet their families, and that's a huge part of what fulfills me as a doctor. So I like to spend time with my patients, but there are other doctors out there who are kind of quick in and out, and maybe bedside manner is not their strength, but their intellect and their ability to diagnose and treat patients is very high. And it's all about finding a doctor that jives with you. So if you're someone that's okay with a fast visit and you just want the accurate diagnosis and the treatment, you'll find a doctor that fits that. And if you're someone who wants your doctor to spend more time with you, be a bit more chatty, there are doctors like that too. And it's all about finding the right fit for you and your needs. Next up, something I want everyone to know is that acne is not a hygiene issue. And I think this is so important because I have so many teens who come into my practice being shamed by their parents, like, he doesn't wash his face after baseball practice, that's why he's breaking out, or he never washes his pillowcase, or he eats pizza and he gets the grease all over his face and that's what's causing his acne. And that's just really not the case. There are very few cases of acne that are truly due to a hygiene issue. The thing is, a lot of kids just end up getting acne in their teenage years. 85% of teens get acne, and it has really nothing to do with how clean or how dirty they are. So when a teen comes into my office with their parents and we're doing education about acne, it's a huge focus on what we can do to improve it and not make the kid feel like they're dirty or they're not washing their face enough, because that is really not the case with acne. Now, if you want me to do a whole video on like preteen or teenage acne and how we treat it, I'm absolutely happy to do that. But just know it is not because your kid is dirty. And in that same vein, I wasn't even going to talk about this, but I feel like I should mention it. The link between diet and acne is there, but it's not a very strong one. And teenagers are already so susceptible to develop disordered eating. And when we focus exclusively on what they're eating as the cause of their acne, it almost shames them into having acne, and it can give them this hyper focus on food that really shouldn't be happening. So although eating a healthy, well-rounded diet is important, when we're working on treating acne for my teenagers, there are so many other more prominent causes of their acne that we can address without giving them a food or eating complex. All right, just a couple more things that every dermatologist wants you to know. And one of them is that sunscreen is not the only way to protect from the sun. I have so many patients who come into my clinic who are very tan or they have a sunburn and they're like, listen, Dr. Ellis, I'm just not gonna wear sunscreen. I hate sunscreen so much. There's no other way for me to protect myself. And that's not the case. UPF clothing is amazing. Long sleeve swimsuits, wide brim hats, avoiding the sun during peak hours. These are all really important and good ways that you can protect yourself from the sun. And no, they're not perfect. And the best way to protect yourself from the sun is to combine all of the methods. But just know you don't need to rely exclusively on sunscreen, and you really shouldn't. Even as a dermatologist, yes, I wear sunscreen every single day, but I really don't like putting sunscreen on my arms or on my legs very much. So instead of doing that, I often just wear long sleeves and pants instead. And that's an okay alternative. And just a note about hats, and I think every derm would want you to know this as well, is that baseball hats aren't that protective. They're a great fashion statement, but if you look, if I put a hat on, if I'm out in the sun, like the entire side of my face is going to be exposed. And really the only thing that this is protecting is my eyes and my forehead. And that's really a problem because we see all the time in our clinic people coming in who have exclusively what we call like a baseball hat distribution of their skin cancers. Their forehead and kind of the top of their nose are protected, but their chin and their sideburn area and their jawline and the sides of their neck covered in skin cancers. So if you're going to wear a hat for sun protection, use a wide brim hat that has a 360-degree brim. Speaking of the sun and sun damage, let's take a moment to talk about tans. Every dermatologist wants you to know that there is no such thing as a healthy tan. When your skin bronzes up from UV exposure, that is a sign of DNA damage to your skin cells. When you have excessive or unprotected UV exposure, the DNA in your skin cells gets damaged, and that damaged DNA sends a signal to your pigment-producing cells called melanocytes and says, hey, can you produce a little bit of melanin or a little bit of pigment to try and protect me? So a tan is your body's way of trying to protect itself. Now, a tan isn't actually that protective, so you have to keep that in mind. Just because you're tanning doesn't mean your skin is actually protective, but it's your skin trying to do its best. I diagnose skin cancer in people with tan skin every single day. So it is that chronic, repeated sun damage that gives that long-lasting tan that also increases your risk of having a skin cancer. Just keep that in mind. And the last thing that every dermatologist wants you to know is that there's really no such thing as perfect skin. And what is perfect skin anyway? I look at skin up close all the time. I look at models, celebrities, etc. They might look like they have perfect skin on a magazine cover or on TV, but I'm up close and personal with it. It's normal to have pores. It's normal to get breakouts once in a while. It's normal to have hyperpigmentation or a little excess hair. Everyone's skin is unique. It's yours. Rather than striving for perfect skin, let's strive for healthier skin. All right, that's a wrap. Did any of these surprise you? Tell me in the comments. Don't forget to like this video and subscribe to the channel. Thank you so much for watching, and I will see you next time.